Welcome, everyone. Thank you for joining our webinar for CUGH. My name is Dele Ogunsheitan. I co-chair the Competency Subcommittee for the Consortium of Universities for Global Health. And today we are thrilled to bring you a webinar introducing the toolkit that we've been working on for the better part of the last two and a half years. I'm a professor at the University of California in Irvine, and I'm really honored to be part of this team today, and I'll let them introduce themselves. We have 4 speakers in addition to myself, and in the order of presentation here on the screen, I'd like to call on Amy to say something about herself.
Hi, everyone. I'm so excited to be here today. I'm a professor at Texas Tech University Health Sciences Center in the School of Nursing, and I serve as the Assistant Dean for Global Health for the School of Nursing. And I've served on the Competency Committee now for several years and have been just very blessed to be a part of this competency toolkit update. So I'm excited to present today.
Thank you, Amy. We will go clockwise. So Dr. Sunisu.
Hi, how are you? Buenas tardes, good afternoon. I am Sunisu. I am in charge of the Unit of International Affairs at Universidad Peruana Cayetano Heredia, and also been blessed to be part of this group in charge of improving this toolkit.
Thank you very much. And Professor Carlos.
Hi, everyone. Buenas tardes y buenos días to everyone. I'm Carlos Alberto Fabron Guzman. I work for the University of Maryland at the graduate school, and I'm also part of the Planetary Health Alliance at the Johns Hopkins School of Public Health. So happy to be here, and hopefully this will be a useful webinar for you all. I don't think I've seen so many people in a webinar in the past year, so excited. We're almost at 200. So thanks everyone for joining, and I know you're joining from different time zones. So thanks, Deli, as well for hosting this.
Thank you, Carlos. I want to echo your thanks and appreciation to the audience. We heard that there are about 700 people who registered. The numbers are still going up in terms of people who have joined us from different parts of the world. But I wanted to assure you that we're recording this, so we will, thanks to CUGH staff, I want to acknowledge Sarah Maki for really helping us get to this point in terms of all the logistics and making it easy to register. She's assured us that the recording will be available on the YouTube channel that UCGH hosts. We also want to make sure that we capture your questions and comments. So please, throughout the webinar, feel free to add questions in the Q&A and also chats in the chat box. Sometimes people want to introduce themselves. I think that's okay. We all have your information. During registration, we collected information so we can reach out to you. But also feel free to reach out to any one of us panelists after today's session if we can assist in any way to support your program in global health education that is based on competencies. So let me begin by sharing with you the agenda that we have planned. We're right now quite on time within our 5 minutes of introductions. You've met all the panelists and the staff that's supporting us. I should also acknowledge CUGH Director, Dr. Keith Martins, for really pushing the agenda to have this updated webinar on the updated competency toolkit, but also just general leadership of CUGH. So we're thankful for his support. I will start by giving an overview of competency-based education in global health. CUGH is one of a distinguished one of many other organizations that are really pushing to get global health education to be broadly available, to have uniformly strong standards of delivery and assessment. And I think this toolkit has been a shining light in the community of scholars and students working in global health. And then I'll talk a little bit about the toolkit itself and the committees that we are working together to ensure that there's collaboration globally. And then I'll turn it over to Amy to give us highlights of the procedures that we went through to get to the third edition of the toolkit. And then she'll give us an overview of the domain on institutionalization and sustainable development. And then we'll turn it over to Dr. Carlos Ferron to talk about the domain for planetary health, and to Dr. Suni Su for the domain on decolonizing global health. And then hopefully we'll have time for verbal discussion and questions from the audience to the panelists. So please feel free again to share your thoughts. I see the chat box is filling up, and we still have more people joining as we speak, now more than 200 people. As I noted, I am really thrilled to be here and to share this, my experiences with you, but it's also a learning opportunity for me. We want to hear from those of you who are engaged in competency frameworks in global health, teaching, delivering competencies at various levels, from pre-service to in-service to continuing professional education. I think we're blessed with the opportunity to be the convener of those experiences. So I was just in Sydney, Australia, where the Global Health Security Conference was held. And my panel, the moderator was Dr. Corina Monaghan, who I had known for many years through our USAID project. And the panel was reconceptualizing global health security, and I was expected to talk to the audience about the development of competencies for global health security. And I have to tell you that I did talk about the CUGH toolkit. The reception was really enthusiastic, and people wanted to know more. So some of you in the audience may have been at that conference, and this is an opportunity for us to maybe dig deeper into the CUGH toolkit, but it was a very lively panel. The idea that we have a strong workforce in global health is not new. It's gained in urgency, not just because of the COVID-19 pandemic, but it was always urgent because we had disparities and differences in workforce training across nations. And every time we have a weak link in global health security, everybody is vulnerable. Every nation is vulnerable. So it's important to make sure that when we do workforce development, which is one of the action packages in the global health security agenda, that we have an opportunity to reach out broadly internationally, make sure that the capacity to train is uniformly strong, and that we have a workforce that can be deployed to any part of the world, and they will still be able to accomplish the goals of global health security. So within the action package for workforce development for the GHSA, the goal is to have fully competent, coordinated, evaluated, and occupationally diverse multisectoral workforce. That's precisely what CUGH toolkit is striving for. And the issue is that we don't have enough. The recommendation is that we have one trained field epidemiologist per 200,000 population, one trained veterinarian per 400,000 animal units. But whether you're in veterinary services or human health services, epidemiologist, environmental health scientist, a nurse, pharmacist, it's important that we emphasize that the competencies for global health are cross-cutting. They are relevant to every professional in the health and global health workforce. And regarding field epidemiology, I was lucky to be part of the technical advisory group that helped over the last 2 years develop competencies for One Health field epidemiology, or what we call the COFI framework. This was the partnership between FAO, WHO, and World Organization for Animal Health. And last month, 12th June, we just about a month ago held a webinar just like this, attended by about 400 participants over 2 sessions, again, very international. And you can download the framework on the COFI website. So we also add a representative of United Nations Environment Program to make it a true quadripartite presentation. But just the 3 organizations with their logos here helped develop the toolkit. Many of you would have been trained in field epidemiology. Putting One Health in the context allows cross-collaboration and interprofessional engagement. And that's really what the world needs. I should also say that there are competencies for One Health workforce academies as part of a USAID-funded effort. We're coordinating all of the competency domains with other competency frameworks, but we have training across many topics. Just to give you an example, we have training in One Health, antimicrobial resistance. The One Health Workforce Academies have trained more than 4,000 learners, registered in more than 7,000 course enrollments, and they come from 92 countries with a good gender balance, almost 60% female, and many are pre-service, 28% are students, which means the remaining 2/3 are in-service professionals. And the hope is that these academies will help people advance in their career path, but importantly, that they can deliver the competencies within their employment so that they make the global health security stronger. The other context of developing a comprehensive global health competencies framework and toolkit is that the World Health Organization's Health Workforce Office recently published earlier this year a collection of national workforce capacity documents. This was part of the roadmap for national workforce capacity for essential public health functions. And I was also lucky to have been part of the technical advisory group. Some of these people may be in the audience, but some of you may know them. This is a technical advisory group that worked on the competencies framework for delivering the essential public health functions. And the documents that we produced, Global Competency and Outcomes Framework for the Essential Public Health Functions, we gave a webinar on 10th of June that this document came out. And it's very comprehensive. It also has the domains that will be recognized by those who are working with CUGH. And on July 4th, last week, on our holiday, I gave, as part of the webinar series, a presentation on competency-based education for delivering essential public health functions. That's available. The recording is available on the WHO website, so you can take a look. It's just fresh. The other group that's working on delivering competency-based training is, of course, CDC's Global Health Protection and Security. They've trained more than 19,000 people in 30 countries, and these topics are quite relevant to the kind of work that we're trying to cover in the CUGH toolkit. So this is just to say that many people around the world, many organizations are really working hard to create these standards of training that make all of the global health workers in the world competent. These partners came together in Berlin last year for field epidemiology training. There's going to be a platform for global field epidemiology partnership. Again, we're looking at all of the competency frameworks that have been developed to make sure that everybody is included. So the role of universities in developing competencies for global health and teaching and practice cannot be overstated. So this is the mandate of the CUGH Competency Committee, subcommittee of the Education Committee. And the third edition that we're highlighting in today's webinar focuses on 3 new domains. Many of you may have used the toolkit over the years, but we have a fresh look. It's updated and revised. So I welcome the opportunity for us to disseminate these competencies and the new edition. I will be representing our team at the 7th AfriHealth Annual Symposium in Nairobi, Kenya, in a few weeks in August. And we'll have a panel to talk about the CUGH toolkit. Also, the Global World One Health Congress in South Africa is taking place in September, and I will have a presentation there as well. So those of you in the audience who are from these locations or will be attending these conferences, we have another opportunity to talk about the CUGH toolkit. So let me shift very quickly then to talk about our subcommittee. I'm really honored to be part of a committed team of CUGH partners. There's not much to say, but I inherited, I think, from Carlos, a really high functioning team that helped us get motivated to push the 3rd edition. We're going to do a survey of adoption of competencies, how people are using them. So today's is just a start, and hopefully you'll continue to work with us as we refine competencies. They should be living documents, right? They should be not static, that we continue to learn about global health risks and teach and train and practice according to the best scientific evidence of what needs to be covered. So I'm going to now just turn it over. You can access the toolkit. We have a lot of information on the website, the CUGH website, about the toolkit. We're a subcommittee of the Education Committee. Many of them will also be in attendance today. But we also are interested in how people use the toolkit. We have a relatively recent recording, just like today's webinar will be available. so you can access the archives of what we've done. We also encourage peer review. The history of the subcommittee has been to push to get evaluation. So this was published in 2015 by people. Some of these people are still engaged in CUGH, but it's delightful to see how the history of the toolkit in having global citizen level, exploratory level, basic operational level, practitioners and program-oriented and advanced level. And we've maintained most of these levels with just additional content and updating the references. We also have other sort of more professionally compartmentalized publications. This one about the toolkit was published in Law, Medicine, and Ethics in 2021 when we were all in the midst of the pandemic. And we continue to see publications. This was 2019 at the Pacific Rim universities. So regional relevance is important to us. And in the third edition, we have definitions, teaching strategies, key terms, resources, websites, articles and reports, videos, study questions. The format remains more or less the same, but you can see all the domains on the left side of the screen. And we will now turn it over to Professor Amy Moore to give us a highlight of how we developed the third edition, and then she'll take it on to talk about the first new domain, institutionalization and sustainable development. Thank you very much, Amy.
Thank you so much, Carlos. So when we started this, looking at the new editions or the new domains for this edition, for the third edition, we talked about adding them, but the more we've looked at the current toolkit at that time, the second edition, we realized that there were a lot of websites and references that were out of date, some of them no longer linked. And so I made a suggestion, let's really update this and go through the whole toolkit again. Some of the websites and the articles are fantastic. We left those in, but if they didn't link, if they were no longer available, things like that, we went ahead and took those out. So when you look at the toolkit, you can look at the references at the everything that's attached to the toolkit. There's still a lot of things that may appear to be dated, but they're really good. So I will tell you, it took over 30 people, and it's like Dale said, it took about 2.5 years for us to complete this. It just seemed to take forever, but we had so many people help. And if I can take this opportunity, that if you're online and you had and you were a part of helping with this, thank you so much, because it was a great deal of work to go through every one of these domains and update them. So I will tell you, for the future, and I don't know if Dell, if you were going to talk about this later, but for the future, we are looking at adding some additional domains. And we are also looking at taking all of the domains that we have and just making a very short document that tells, here are the global health competencies, and making just a shortened version that doesn't have all of the lessons. But I'm going to proceed now, and I'm going to talk about the first domain that we have added. And so I'm going to share my screen here. Let me start this. So sorry, let me get this started. Play. Okay, so we're going to talk about, and I'm hoping that this is showing, if somebody can. Okay, great. So the first new domain that we added was the institutionalization and sustainable development. And I think I have to have that up there. Let me start that again. I do apologize. It took up my whole screen, so it took away my notes. Wow, this is kind of difficult because it took away all my notes. So one of the things that we looked at with this domain is that we wanted to look at the sustainable developmental goals and those metrics. And so that's what this domain is about. And we have 4 different competencies for this domain. One is research, one is governance, one is metrics and evaluation, and one is goal setting. And I don't know about all of the other disciplines, but this really speaks to nursing a lot. But I know it probably has a lot to do with other disciplines as well, but this really spoke to my heart being a nurse. And so when we looked at the research, one of the things that we looked at was the systematization of experiences and targeting the SDGs. And for each one of these, I did want to pull a study question that highlights this. And I will say in all of our domains and all of our competencies, we put some study questions in so that you can use with students for education. And I chose one, and I believe Lyndon wrote this one, this competency, but this was an example of looking at research across low or middle or high income countries and seeing what are our priorities, what are our targets, and how are we doing across all of those and those areas, and what are the barriers across those, and looking at different type of countries. So I thought that was and I'm just highlighting one question for each one of these domains. So when you look at the different domains, there are multiple questions that you can choose from. And I think that's one of the good things about the toolkit. You can use just small parts of the toolkit, small lessons. There are a lot of websites and material in each one of those domains that you can use. You can use all of them, or you can just use certain, just small amounts. In the second domain, we looked at governance, and we looked at governance from different countries and really looking at how do we undertake the cross-sectoral work across the governments and be accountable. And so the study question that I used on this was based on an article titled Ideas on Governance and for Sustainable Development Goals. How do we monitor governance? And I just thought that was a really good question. So you have to go back and look at the article and think about monitoring our governments and how are we working on the SDGs in different countries. And I just thought that was a really good question. The third one is metrics and evaluation. And this is one that speaks to me because in nursing, we always have metrics. How well are we doing? And so when we look at the United Nations Sustainable Developmental Goals and the global burden of disease, how are we evaluating what are we doing? And if we're not getting to where we should be, what do we need to be doing to get there? And so the study question that Dale, if I'm correct, I think you're the one who wrote this one. So one of the questions that I pulled to highlight this area was to select 3 countries representing the different type of countries and look at the SDG index and compare and contrast where countries are and why are there differences? Why are some people meeting those goals and some people aren't, and where people are? The next one was goal setting, and this is looking at what goals are we setting? And one of the things that we looked at in this are our goals actually, are they realistic? And so sometimes when we set goals, they are not realistic goals. And so they should be, they should be measurable, they should be attainable, they should be timely. And so we looked at using SMART goals, which actually is measuring those type of goals. And so that was a very, very quick overview of our domains. And so I'm going to stop sharing here. And I probably spoke very quickly, but our next speaker will be, I believe, Carlos.
Thank you, Amy. Yes.
Thanks, Amy, and thanks, Deli, for the welcome as well. And just again, welcome to everyone. We have almost 275 people around here, so I'll try to keep this interesting and brief so we can have a lot of discussion. I'm probably assuming there's questions and comments that will need to be addressed. So I will share my screen. Just if you give me 1 second, I'll pull it up. And wait, where'd it go? Okay, that's not it. Here we go. All right. So I was speaking to the domain that relates to planetary health. And one of the reasons that we wanted to add a domain in planetary health to the competency toolkit and the competency framework in general of global health is because obviously there's been an increasing intersection on how these grand global environmental challenges are affecting global health, right? And when I say grand global environmental challenges, I'm not just speaking about climate change, which is the one that gets the most attention usually, but I'm also talking about the crisis that we have with our ongoing quickly declining biodiversity, that is the crisis of biodiversity loss. I'm talking about things like pollution, right? The pollution of our air, the pollution of our oceans, the pollution of our rivers, the pollution of our soils, etc. Right? I'm also talking about how we've drastically changed the way we use land and what we use that land for. I'm talking about things like a massive resource scarcity, like water scarcity around the world, talking about changes to our oceans and their acidity and its temperature. So there are these grand things, right? Environmental challenges and changes that are happening at a global scale that are interacting ever more with what we usually consider global health crises, right? Whether it's migration, whether it's infectious diseases, whether it is the most basic things like food, shelter, human rights, etc. There is an increasing interaction between these two things. So we wanted to make sure that people that were studying in the field of global health were well versed in these aspects of grand environmental challenges and how they are impacting health, right? And so some of the work that has been done up to now, right, and kind of expressed in this editorial by The Lancet, which speaks to the fact that there is no public health without planetary health. We can't separate the fact that all these global health challenges that we have considered from the global health community are happening in the context of a grand environmental health challenges as well. And that is because, as the editorial says, the future of health and the planet, the future health of the planet and human health are inextricably linked. So this is part of the message that we at the Planetary Health Alliance, and forgot to mention that I am here representing both the University of Maryland, Baltimore and Johns Hopkins University and the Planetary Health Alliance, which is now based there, that we have been working with different institutions like the Consortium of Universities for Global Health and others, as I'll tell you in a second, in order to advance the understanding of planetary health around the world, increase how we understand the science, but also the education components, the policy aspects, the community building aspects, among others. Part of this also relates to how there's a growing awareness, right, of how these grand global health challenges and grand environmental changes are affecting health. And we see that clearly on things like the agendas that we are, the agendas of large global events that are influencing policies around the world. So if you followed what was happening in COP last year, there was for the first time, you can see here on December 3rd, for the first time, there was a day dedicated to health, right? And never in the story of the history of COP, in the 27 preceding COPs, had there been a focus on health. So this is a recognition on how health is increasingly becoming part of the conversation in these environmental circles, but as well how in the health circles, environment is becoming an increasing part of the conversation. We're also seeing growth in not just the policy circles, but also the research circles. And this is a figure taken from a paper we published a couple of years ago with the University of Geneva, in which we could see a clear trend of rising, not just in the absolute, but the relative number of papers that are related to planetary health. And the same trend goes for other fields like EcoHealth and One Health. That is, this intersection is increasingly becoming more clear. And it's also becoming more global, not just the conversation that is happening around the what we call kind of Euro-Western perspectives. But as you can see here, where you see a little green dot is where there is an emergence of research in the intersection of environmental health and global health. So again, part of the conversation is growing quickly. We wanted our people that were being educated on this in global health to be deeply aware of these challenges. Some of those changes are already materializing in important changes. Let's say, for example, in this Canadian declaration on planetary health, in which all the medical schools in Canada and their deans have signed a declaration that says planetary health is important. The changes of our global environment are leading to challenges in health, and we should do something to shift our education systems in the health realm in order to have health professionals be better versed at these challenges. So this declaration, again, ratified by all medical schools in Canada, serves as an example on how different actors around the world are starting to shift the needle towards this increase in education in planetary health and related topics. Now, when we talk about education in planetary health, we're talking about usually this graphic, which we call the Planetary Health Education Framework. Now, briefly, what we are saying when we're saying, what do we mean by planetary health education? We're talking about these 5 domains, right? And as you can see, this figure is more or less, you have to imagine it as a cord or as a rope that has 5 threads. And so those 5 threads are cut in a coronary aspect. If someone studied anatomy, they know what I'm talking about. So this is kind of you're looking at the cord being cut from the front. So the first aspect of the planetary health competency education framework is the understanding that there is this time right now that we're going through called the Anthropocene, that is a time in which humans are the driving force or the primary driving force of change in Earth's natural systems, and that is affecting our health. Now, here we study the interactions between some of the factors that determine those health outcomes, the interactions between the grand environmental changes, the interactions between health systems, governance, ethnicity, race, and all these things, and how they impact health of people. We also study that through a lens of equity and social justice. That is, how is this impacting different populations unfairly, and who is causing some of the challenges that we're seeing, right? So equity and social justice is part of the lenses that we use to teach planetary health. And we also use the lens of system thinking and complexity, that is in order to understand better how the different systems are interacting with each other. We are very solutions oriented as well. So we do teach how change as well needs to come from top down policy change, but also bottom up movement building. So it's an and approach when it comes down to systems change. And finally, we focus on this aspect of interconnection within nature in order to redesign kind of how our value systems have been historically connected to nature. And with time, we've become disconnected from nature, and some of our actions are a reflection of that disconnection, and talking about different value systems that can drive better change and behavior in future health professionals. 2 of the things that usually get out on the conversation is that are these 2 outer circles of the framework, which basically are trying to tell educators and learners around the world that whatever you might be learning in the intersection of environment and health needs to be happening with a really deep awareness of the local context, right? And how that local context is interacting constantly with a global context. Obviously, the relevance of learning needs to be local, right? Because the manifestation of climate change in a given region will be different from region to region, right? It's not the same to talk about polar bears in the Arctic than to talk about drought in the let's say, Peri-Saharan region. So part of it is also contextualizing the learner. If you want to read more about the framework, there's two resources here that I will direct you to. They're both on the Planetary Health Alliance website. You can read kind of the full framework, which is a kind of 35-page document, or you can read the 2-page publication that we did on the Lancet. Now, how do we translate this into competencies for global health? And this will be my last set of slides. We've already developed a competency set for global health learners, and I invite you to go through them, right? But in short, they are a reflection, right? This is a reflection of the framework, right? We've tried to adapt the framework for a global health audience. We're trying to do that for nursing communities as well. We're trying to do that as well for medical practitioners. We're trying to do that for public health practitioners. We have made progress in the global health community, education community, in order creating these competencies that now will guide educational reform and curriculum design for global health practitioners. And in addition, we've also brought that down, right, to learning objective levels. And this comes from the work from Dr. Jacobson and Dr. Carol Waggett. Catherine Jacobson and Carol Waggett lead this group within the CUGH that's called GECO, the CUGH Global Health Educators Community. And they have developed, in conjunction with this competency domain, a set of learning objectives. And these are things that you can bring down already to the classroom, and you can apply. They're kind of plug and play, ready to go, in addition to the resources that we have developed for the competency domain. So in combination, these things can help you design pretty quickly a module, a class, a course on these interactions between grand environmental changes and global health. Anyway, thanks again for attending. Those were my 10 minutes. I'll stop here and wait to see if there's any questions.
Thank you, Carlos. There are questions. And now let's turn it over to Suni. Thank you.
Thank you so much. Allow me to share my presentation. 1 second. Okay, so let's start now talking about this last domain number 14. It's about decolonizing global health. Now, a disclaimer, I have to say that I am very consciously biased about this one being my favorite one, the one that it's going to help a lot, like educators in global health. So before we go to kind of explain this word decolonizing, just in case this is the first time that you come to one of our webinars, this concept global health, right? This is this area of study where we want to achieve equity, right? That means fair opportunities for everyone, and that it's about interdisciplinary collaboration, right? And I think that this is not the first time that it's mentioned in this webinar so far. No matter your expertise, no matter if you're an engineer or an economist or a physician, nurse, or you work in public health, to work together. Very important thing about when we talk about global health and about decolonizing, to make this sustainable, right? Knowing that we are in this moment living in what we can say it's a borderless world. Okay, so now that we have that, that we mentioned that, let's go and try to understand a little bit what we are trying to say when we say decolonizing global health. I mean, what you see in this slide, it's literally a copy paste of what you can find in the toolkit, but allow me to make it or say it in simple words. When we talk about decolonizing global health, we are talking about this critically to examine or to address about historical but also ongoing power imbalances and inequities. Let's stop 1 second there. I mentioned two interesting words, historical and ongoing. Ongoing, we know that there are still like inequities, right? When we talk about global health or healthcare. But let's talk a little bit about the other word, like historical. What is this about? It's about us remembering, but more than remember, not to forget, right? The impact of like colonialism or imperialism or exploitation or racism in our structures, health processes, or policies. When I say ours, I am talking about low and middle income countries, right? So this is decolonizing global health. If you ask me, Suni, like which one are like the goals of like this decolonizing global health, right? I think that I will say three, right? One is to bring or to practice with like equity. That's the one of the important ones. Second, empowerment. If we know that there are like all these like power imbalances, like to empower the ones that are not in charge maybe of making the decisions, right? And the last one, and the one that speaks the most to me, right, like resonates the most to me, is to value and to integrate local knowledge, right? Like there are certain things that we do okay and even better, but we were imposed in the past, right? I am talking imposed or told or made to accept and to adapt, right? Yeah. So those are kind of like the three goals that I want to mention about decolonizing global health. And in conclusion, like for me, decolonizing global health, it's to be bold, to challenge the status quo. It's like to transform and do something about power dynamics. Okay, so now I think we have like a good idea, right, of like what is this like decolonizing global health. We developed like 4 competencies, right? Here you have kind of a summary of each of them, and I will also like mention a little bit about like the strategies or learning strategies that we propose, right? If you want to use the first competency. It's about like understanding this legacy of colonialism, imperialism, and how that shaped how we work and even research at this moment, right? So that's the first competency. And like, if you ask me about like learning strategies that you are going to be able to find in this toolkit, it's like first, historical background, right? Like, let's tell our students what happened in the past, so we don't make the same mistakes. Allow them to brainstorm, right, about like the impact that they think like this colonialism and imperialism can have in our systems. You can also use case scenarios, and what it has been like very helpful for me teaching intercultural competencies, right, to my students. It's real case scenarios. That's how they are going to like kind of understand right away what you are trying to say. The second competency, it's about recognize and also analyze critically, right, about these power imbalances when we are like trying to practice, right, medicine, or even like work in research, right? And when what we want, it's like both sides or all the parties get the benefits, right, of this research. What can you do in order to like teach your students this competency? Definitely like is historical background, right? But two important things, critically thinking, right? Like make your students to realize the role of all the actors. And what I am trying to say is like, make them realize who is making the decisions, right? The other one, you can make like you can ask them to make like a checklist of the impact, right, of their like perceptions in how they work in global health. The third one is self-awareness, and it's about like not also self-awareness, but continuous self-reflection about like this impact in how we work in global health and research. So you are self-aware about like your position, like your culture, your perspectives, and also continuously be self-reflect continuously about like how this impact is important about when you work cross-culture in global health. And the last one, and you can see there that I am asking like which one, pick your favorite competency, right? Like this one is my favorite one. That's why it has like the biggest box. It's like being culturally competent, right? It's like implement this approach of cultural humility, and this needs to start about us knowing what is cultural humility, right? This like comes to my mind about like cultural intelligence, right? Like how can we make our students, not only our students, how can we ourselves become more cultural intelligent? And just for you to know, like cultural intelligence is this capability or ability to work effectively and also appropriately cross-culture, right? In a multicultural setting. And this is like this competency about, if you ask me like how I normally use, right, like this domain and this competency is like I have this trifecta of like all the knowledge, all the skills, but also all the attitudes that we need to give or make our students to know about, like which are like the topics that they need to know in order to be culturally competent, all the skills that they need to practice so they are good on that. Then the last thing that I want to mention is like these resources that we are also giving in this toolkit. You are going to be able to find like websites, articles, reports, books, workbooks, curriculums, and the ones that I enjoy personally and the ones that I use with my students is videos and podcasts. Just a tip from me. This is a regalo for you. It's a present from me. If you are going to start using like this domain, the domain 14, review and also make your students to check the domain 3 and 5, specifically 3A and 5D. These three domains, they have like a virtual cycle, right? Like they complement each other in a beautiful way. Oh, my last slide, I think. I mean, talking about being culturally competent and like decolonizing global health, like just one cultural misunderstanding can cost a lot, not a lot of money, a lot of time, a lot of effort. So I think it's a good idea to try to improve our cultural intelligence. I wanted to be my last slide, and I want to quote quote David Livermore, like the number one predictor of success in today's borderless world is our cultural intelligence. This is, in a way, a little bit what we want to offer in this last domain. Thank you so much.
Thank you very much, Suni. I want to remind the audience that you are at least a day's trip from Lima. You are in Chachayanos, I think, on a field trip, and we are so grateful that you were able to join us today on a very, very important competency domain on decolonizing global health. We have had a lot of questions in the chat and the Q&A box. Really engaged conversations going on there. All of it will be captured. But we also have just a few minutes now. If anybody wants to raise their hand and ask a question, we've tried to answer most of the questions in the chat, but I just also want to make sure that we give voice to some people who may have additional questions that we have not covered. Let me just say that I think there was one question about the goal of today's webinar. There are many, many domains in the toolkit, as Amy mentioned. The second edition of the toolkit had been available for a number of years. And what we chose to do today is to highlight the three domains that we thought added value to the toolkit itself, but also responding to some of the queries and concerns about the original toolkit and the process that we went through. I think we're more inclusive. I think Suni's presentation really addressed some of the topics that have come up in the last few years about global health education and practice in general, but also planetary health as we now confront climate change, as health is one of the key topics in the concluded COP28 conference. I think we owe it to ourselves to teach about planetary health within the global health context, and also what it means to be developed, and institutionalization of sustainability and development are all part of the questions that have come up in the last few years. So, I think those three new domains will not be the end of the toolkit. We'll continue to update and revise, and we will take your advice. There is a forum for providing input, and we want to make sure that you all are aware of those. There are many more questions, I think, in the Q&A, but a lot of it also, can we give example of cultural misunderstanding? I don't know if Suni wants to address that, because that's one of the biggest topics that we continue to encounter.
Yes, thank you so much. That's a really good question. Sometimes, depending on the cultural background of, let's start with like a colleague, right? Like what is about, for example, punctuality, right? And what that means to the group. Like here, and I will give an example. Here in Peru, we say like the hora peruana, and maybe that it's going to be disrespectful for like some people in the group. So there are like certain things that are linked to our culture that are not going to allow us like to work interdisciplinarily in the best way.
Thank you very much. There's a question about how to access the toolkit itself. The CUGH competencies toolkit, if you type that into Google, you will immediately go to our website, and there's a button you can push to download it. All the resources that we talked about today are available on that site. So we're always updating the site with new information. In the last minute or so that we have, I'd like to yield to Amy and Carlos to say any last minute comments that you'd like to share.
Thanks, Daly. Oh, go ahead. Sorry.
Oh, I'm sorry. There was a question about competencies crossing over, and in many of the competencies in the toolkit, you'll see that this is an addition to another competency, that they do cross over a lot. And something else that we added that I didn't mention was we added disability information to all of the competencies as well. So we had a faculty do that.
Thank you, Carlos.
Thanks, Amy, and everyone again for your attention. There was a question in the chat regarding how does planetary health domain interact with the decolonization domain. And of course, these domains are in let's say, in domain categories for our sake and for making it easier to kind of talk about them, but there's huge intersections between them. So for example, part of what we teach in planetary health is the equity and social justice perspective that needs to be embedded in the planetary health. Part of it is, yes, who is causing the challenge and who is, let's say, suffering the consequences. In Spanish, we say, se come la piña y a mí me duele la panza. You eat the pineapple, but it's me that, my tummy that hurts. So this is part of the conversation for sure. And again, I know we're at time, so I'll stop there, but thanks for the question and for all the engaging in the chat.
Thank you so much. And Suni, any last minute? You've shared a lot, all of you, but
No, just to mention that in order to be able to teach intercultural competencies, we need to be very competent first. So let's educate ourselves and build our own competencies. Thank you.
wonderful, wonderful. Thank you so much, everyone. We want to respect everybody's time. I see we still have close to 200 people who stayed with us till the end. And please spread the word. The toolkit is available on the CUGH website. And we look forward to working with you as we implement and adopt and revise and update. Please join us. Thank you, everyone. And thanks again to CUGH for hosting this webinar. Sarah and Keith, we're very grateful.
Bye, everyone.
Bye.
Bye.